What if a simple glass of contaminated water could transmit a virus capable of causing large outbreaks of hepatitis? This is the story of the Hepaviridae family. The family Hepaviridae contains viruses that primarily target the liver and are responsible for hepatitis E, one of the most common causes of acute viral hepatitis worldwide. Although hepatitis E receives less public attention than hepatitis B or hepatitis C, it remains a major global health concern, particularly in regions with limited access to clean water and sanitation. Hypoviruses are non-enveloped positive-sense single-stranded RNA viruses. Unlike many other medically important viruses, they do not possess a lipid envelope in their environmental form. This characteristic helps them survive under conditions that would easily damage many enveloped viruses. The most important member of this family is hepatitis E virus, commonly abbreviated as HEV. HEV primarily infects hepatocytes, the specialized cells of the liver. After entering the body, the virus travels through the bloodstream to the liver, where viral replication occurs. The resulting immune response contributes to liver inflammation and the clinical symptoms of hepatitis. One of the defining features of hepatitis E virus is its mode of transmission. In many parts of the world, infection occurs through the fecal-oral route, most commonly through contaminated drinking water. Large outbreaks have been documented in areas affected by poor sanitation, flooding, humanitarian crises, and inadequate wastewater treatment. This transmission pattern distinguishes hepatitis E from hepatitis B and hepatitis C, which are primarily blood-borne infections. Scientists have identified several major HEV genotypes. Genotypes 1 and 2 primarily infect humans and are commonly associated with waterborne outbreaks in developing regions. Genotypes 3 and 4 can infect both humans and animals, particularly pigs, wild boar, and deer. These genotypes are often associated with zoonotic transmission through consumption of undercooked meat products. As a result, hepatitis E represents both a waterborne disease and a zoonotic disease depending on the viral genotype involved. Most HEV infections are acute and self-limited. Many infected individuals experience no symptoms at all. When symptoms occur, they may include fatigue, fever, nausea, abdominal discomfort, dark urine, and jaundice. Most healthy individuals recover completely within several weeks. Unlike hepatitis B and hepatitis C, chronic infection is uncommon in immunocompetent individuals. However, chronic hepatitis E can occur in immunocompromised patients, including organ transplant recipients and individuals receiving immunosuppressive therapies. One of the most important aspects of hepatitis E epidemiology involves pregnancy. Infections caused by certain HEV genotypes during pregnancy, particularly in the third trimester, may be associated with significantly increased risks of severe disease, acute liver failure, and maternal mortality. The reasons for this increased vulnerability are still being investigated. Diagnosis typically relies on molecular testing for viral RNA and detection of specific antibodies produced by the immune system. Treatment for most cases is supportive, focusing on hydration, nutrition, and monitoring liver function. In selected chronic infections, antiviral therapy such as ribavirin may be considered under specialist supervision. Prevention depends heavily on public health infrastructure. Access to safe drinking water, effective sewage treatment, proper food handling, and sanitation programs remain the most important tools for reducing disease transmission. A vaccine against hepatitis E has been developed and licensed in China, but it is not yet widely available globally. Because of its association with water quality, food safety, and zoonotic transmission, hepatitis E provides an excellent example of how environmental health and infectious disease are closely interconnected. Today, the Hepaviridae family continues to be studied as researchers work to improve prevention strategies and reduce the burden of viral hepatitis worldwide. The Hepaviridae family demonstrates how access to clean water and proper sanitation can directly influence infectious disease risk. Understanding hepatitis E helps reveal the powerful connections between environmental health, public infrastructure, and global disease prevention.